So I think it's a very interesting question as to which BTK inhibitors to use and in which order to use them. And I think that what I tell you today might be very different to what I tell you in 5-10 years' time. There are a number of first and second generation BTK inhibitors that are licensed and that are in use, so Ibrutinib, Acalabrutinib and Zanubrutinib. And because they all work in a very similar way, that we wouldn't sequence and use one after the other, because if you lose response to one of them, you're unlikely to have a significant response with either of the other two. So we might sequence them if someone is on one BTK inhibitor and develops side effects or tolerability issues, then you might switch to another one. But otherwise, it's kind of an either or. But there are other ways of targeting BTKs now that would still potentially, you could still potentially use after patients have lost response to their initial BTK inhibitor. So for example, the reversible BTK inhibitors such as Pirtobrutinib, we know shows activity in patients whose disease has lost response to either the first or second generation BTK inhibitors. So currently, I see Pirtobrutinib when it's licensed and in use coming after the first and second generation BTK inhibitors. But as I say, that may change with time and with more trial data that's coming out. And what's also interesting is other ways of targeting BTK, such as BTK degraders, which again may prove another option of targeting BTK even when Pirtobrutinib has lost its response as well.